let's start again with the discussion of aortic regurgitation. Now, we were discussing when do you refer a patient for surgery in case of aortic regurg. First thing is symptoms. If the patient becomes symptomatic, fine, the patient needs surgery. But what about asymptomatic patient? Do you send them for surgery? Now, to take this decision, we have to look at the patient's echo. If the ejection fraction is lower than 50 or maybe 50, just 50, now that is an indicator of surgery. You have to send the patient for surgery. But what if the ejection fraction is normal? Would the patient require surgery? Now, to take this decision, you have to check the patient's volume. So, the dimensions of the LV. If the end diastolic diameter of the LV is more than 70 millimeter, or the end systolic diameter is more than 50 millimeter. Now, those are the two very important marker that requires surgery. So you have to send the patient for surgery. Anything else? Suppose a patient has moderate to severe air, but the patient also has dilatation of the aorta, which crosses the cutoff for surgery. So the patient probably requires a replacement of the aortic root. In that case, if the aortic root replacement is done, then you have to also change or replace the valves. And if the patient has other valvular disease, for example, the patient has mitral stenosis. So if there is concomitant mitral stenosis and the patient is undergoing an MVR, you should also plan for an AVR. Why is that? Because if you have mitral stenosis, especially severe MS, that will underestimate the air because there is low flow from the LA to LV. Now the air is underestimated. But whenever you change the valve, change the mitral valve, then the flow will increase and the air from moderate, it will become a severe air. So change the valve together. Change the mitral valve, fine. Also change the aortic valve if it's at least moderate air. So try replacing the aortic and mitral valve together. Now, next question is how bicuspid aortic valve causes both AR and AS. How is that, or why is that? The answer is bicuspid aortic valve causes AS because of damage to the valve thickening and immobility leading to restricted opening. That is the mechanism of AS or aortic stenosis. But how does it cause AR? First thing is, as the valve becomes thickened and immobile, not only has difficulty in opening, but it also cannot close properly because of the immobility. So there is a gap causing the air. Another thing is, bicuspid aortic valve is often associated with an aortopathy or dilatation of the aorta. Now, if there is aortic dilatation, it will cause dilatation of the annulus. And if the annulus is wide, then the valve leaflets will not be coapting well, will not be closing in. There will be a gap. And that is the second cause of aortic regurg in bicuspid aortic valve disease. Another question is, when can you hear the aortic regurgitation murmur in the right side of the chest? Normally, we find the aortic regurg murmur in the left side of the chest, left sternal border, third and fifth intercostal space. But if there is aortic dilatation, such as root dilatation, now that will change the direction of the regurgitant jet, and you might find the murmur best heard in the right sternal border rather than the left sternal border. And the question is, how does Austin Flint murmur occur? What's the mechanism? So the answer is there are two mechanisms for Austin Flint murmur. Number one mechanism is whenever there is aortic regurgitation, the blood that comes from the aorta hits the anterior mitral leaflet, and that causes fluttering of the anterior mitral leaflet, and the anterior leaflet cannot properly open. So as it cannot open, the mitral valve orifice is narrowed. There is a functional mitral stenosis. So that produces a mid-diastolic rumbling sound. Another thing is, whenever the air jet hits the LV free valve, that also produces a vibration that contributes to the Austin Flint murmur, which is a mid-diastolic murmur found in the apex. Now that's it. Those are the questions that I had in my mind and written down in my notes. Now I shared them with you. Hopefully you will like them. Those are so beneficial for any types of exam. See you in my next video.